So what is pyelonephritis? Pyelonephritis is simply an infection in the kidneys. So generally, when we talk about infections in the genitourinary tract or urinary tract, we divide them into 2 or 3 conditions, one of which is a simple UTI. That means you have an infection only in the urine, which hasn't spread anywhere else in the body or higher up in the urinary tract. So you need to understand where the urinary tract begins. So you have the urethra, the bladder, the ureter, and the kidneys. Now, when you have a simple UTI, it means there are some infections just in the urine, and there's something called cystitis, which is when you have an infection in the bladder, and then you have pyelonephritis, which is higher up in the kidney. And these simple UTIs can always move up and cause pyelonephritis. So what is pyelonephritis? It's simply an infection in the kidneys. Now, there are different types of pyelonephritis. There's regular pyelonephritis, where any bacteria can cause an infection in the kidneys. The other type is called emphysematous pyelonephritis. This means that gas-producing organisms in the kidney can cause the kidney to fill with gas, which is called emphysematous pyelonephritis. And there's another condition called xanthogranulomatous pyelonephritis. This is diagnosed by examining tissue. We can't diagnose it with any imaging or other tests. We have to take a sample from the kidney for testing. This is generally a very rare condition, xanthogranulomatous pyelonephritis. But simple pyelonephritis requires 4 antibiotics. That means the infection is a bit more severe, depending on the patient's condition. Generally, we treat pyelonephritis with 4 antibiotics. We don't use simple oral antibiotics for treatment. A minimum duration of 7 to 14 days is required, depending on the patient's condition, when treating pyelonephritis. The imaging methods usually include ultrasound or CT scan, along with a simple urine test and a urine culture to determine the severity and which organism is causing the pyelonephritis.